first aid injury and 45 days without a vehicle incident. If you look over there on this day in history, last year we were 120 days without a recordable, 38 days without a first aid injury, and 43 days without a vehicle incident. So we're pretty close on track with where we were last year. We will be putting in another vehicle incident today, so that's going to reset. Today we're going to talk about early signs of a cardiac or heart emergency. All right, so the difference between a cardiac arrest and a heart attack is when you have a blockage in the heart. So the arteries that surround the heart makes the blood go around and around and around the heart. So your heart can make the blood go around and around and around your body. Those will get blocked, and that's a heart attack or myocardial infarction. Versus a cardiac arrest is when the heart stops pumping effectively. So it could be quivering, it could be doing nothing, but it's not pumping blood at all. So it becomes an ineffective pump, and that's a cardiac arrest. If you leave a myocardial infarction or heart attack long enough, it will cause a cardiac arrest. But a lot of things can cause it. So you have heart attacks, trauma, toxins and poisoning, lack of oxygen. And so one thing that I need to point out is for guys, once you're in your 20s, you slowly increase in likelihood of having a cardiac or a heart attack. But for women, it's fairly flat. And then once they hit menopause, and it shoots up like crazy, and they end up passing then in the likelihood of having a myocardial infarction. You can have metabolic imbalances. So like you go to your doctor and they give you really bad lab values for different things. Severe allergic reaction, sepsis, which is when you have an infection, it starts to spread through your body and your body starts to treat itself instead of the infection. You have hypo or hyperthermia, so you're too hot, too cold, and many more things can cause cardiac arrest. So here's a picture of what a heart attack looks like. So if you look on the left, there's not really blood that's going through those different blood vessels in the heart. And then they go in, they basically roto-rooter it out. And on the right is the afterward. So you can see that that blood's traveling nicely through those blood vessels. We're not going to do any EKG interpretations today, but on the right is an MI. So your textbook signs of myocardial infarction or heart attack are severe chest pain, especially on the left side, radiates down the left arm, difficulty breathing, and jaw pain. So these most often, these are the textbook signs, but what often happens is people either ignore them or they don't have these specific signs of a heart attack, so they don't get treatment. So your common symptoms, though, are chest pressure, difficulty catching your breath, anxiety or sense of impending doom, shoulder blade or arm pain and tightness, neck pain or tightness, abdominal pain, dizziness or lightheadedness, nausea with or without vomiting, indigestion or heartburn, general malaise, so you're just not feeling well or right, changes in skin tone, clamminess, fatigue, and palpitations, so it feels like your heart's pounding. So you could have any combination of these. You think, oh, I just have a 24-hour bug or whatever, and then it leads to a cardiac arrest because it's not treated. If you do get seen at the hospital, a hospital capable of dealing with it for a heart attack, they're very good at fixing the problem. It's just a matter of getting in a timely fashion before there's too much damage. So other heart conditions, your heart pumps due to small electrical pulses through the cardiac muscle. When these electrical pulses go through damaged tissue, they can cause the rhythm of the heart to change. So you have things like AFib, which is very common and can lead to strokes, but it's just an irregular beat. You have bradyarrhythmias, which is when your heart beats too slow. If it's below 60 beats per minute, that's not normal for you. That's a problem. Tachyarrhythmias, or the heart goes too fast, and that's anything over 150. If you have symptoms and your heart's going over 150, call 911. You have two different types of strokes. You have ischemic, which is a blockage of the blood vessels of the brain, similar to what I showed you guys with the heart attack, except for it's in the brain. It's commonly caused by untreated AFib. It's lower risks for coagulated patients, if you're on blood thinners, you have lower risk of ischemic stroke. Not generally accompanied by a headache, and typically causes your standard stroke symptoms. So your facial droop, arm weakness, stuff like that. And then you also have hemorrhagic strokes, or which are when you have bleeding in your brain. Could be many causes. A lot of them are trauma, but well, you have much higher risk with anticoagulated patients. So if you're on blood thinners, you have a higher risk, especially if you hit your head. It's going to be generally accompanied by a headache and may have an array of non-specific symptoms. So it may start with just some difficulty speaking and things like that, and then grow into, unconsciousness, so on and so forth. So your stroke symptoms that you're most likely going to see with your ischemic stroke, so your blood vessel blockage, are going to be facial droop, one-side weakness or paralysis, so you can't move it or not well, difficulty speaking, loss of sensation, vision changes, and balance issues. The most important thing with a stroke is to figure out what time they were last seen normal. So it's not when you notice the symptoms starting, it's when you last saw them normal. So that might have been yesterday, but if you didn't see the symptoms start, then you don't know when they were last seen normal. What to do if you suspect a cardiac event, call 911. Time for any of these is critical. Keep aspirin around. Those are in the white first aid kits. Take it as directed by 911 agents. You want to remain calm. You want to follow medical advice. All the dispatchers are trained in walking you through what to do in the time before the ambulance arrives. A heart attack or an MI may not show itself on an EKG, so there's kind of this misconception that it's always going to show up. There's a whole class of MIs that don't show up, or they don't show up immediately. Remember to see your doctor regularly. If you want to join the wellness program, just reach out to Matt or myself. Consider a watch with cardiac monitoring if you're at higher risk, and get CPR class or CPR certified. And this says next class is Tuesday. That's pending. So we'll figure out if that ends up happening or not if we have interest. So correction, Wednesday. Sorry, my apologies.
Yeah, very informative, Tom. Very critical too. Like you said, time is really important. So yeah, with a heart attack or a stroke, get a medical advice right away. And we've seen some things happen on sites and in the office. So don't believe that it can't happen to you or to your fellow coworkers, because it's one of those things that's just a chronic exposure that just happens out of nowhere.
Yeah, we had an employee years and years ago, and he wasn't feeling right. Went to the hospital. They said he was going to go to the bathroom before he got seen, and he ended up passing away in there. So,
yeah. Yep. Okay. Can you guys see my screen?
we do. Yes, sir.
So today we talked about cardiac arrest, and I think a good idea would be to join the wellness program if you're not already in, because they can help identify a lot of things with your body before they become a problem and before it turns into something like a cardiac event or a stroke. And Tom and Matt can help if anyone has any issue, like how do I get in the wellness program? Talk to either Tom or Matt or Aaron, and they'll help you. Okay, code of conduct: don't overpromise or underdeliver. Let's be honest and realistic, and let's build in some contingency for unknowns that could happen, especially in the winter when we're trying to get somewhere. Give yourself a little extra time. So the ownership topic of the week. Good question for you all. How do we demonstrate integrity? Know and live your core values. Our core values, they help us make good decisions, and they guide us in making good choices that we feel good about and that we can stand behind. It determines our purpose and direction in our life, and it helps us get through it with pride. So our personal standards get us through and make us who we are. They align what we say and do with what we believe in. It makes us stronger and more authentic. Setting and following high standards feels good, and it leads us to better outcomes. So how do you do this? How do you identify what your core values are? If you ever thought about it, use your past experiences. Those are going to help you to develop and know what your core values are. When you're happy and you're proud of things, that's a very revealing way to discover your core values. When you're stressed out, when you're uncomfortable about things and it doesn't feel right, those are indications that you're getting close to the edge and stepping possibly across what your core values are. The old timers, when I came here, always used to say, follow your gut. Your body always knows when something's not right. So that's that uncomfortable feeling in your stomach. And it tells you what to do. And it's usually right. You ever have something happen and you're like, I knew it. I felt that was going to happen. I knew that bank was going to cave in. That's our internal intuition. It's our gut. You want to listen to it and at least consider what it's telling you. It's got me out of a few pinches, and I've also learned a lot from not following my gut over the years. As employee owners, we owe it to ourselves and each other to know and follow those core values. We make decisions based on what we believe in. That demonstrates our integrity, our authenticity, and our commitment to what our principles really are. It ensures that our actions are aligned with our purpose, and it builds pride in ourselves and each other. It also helps keep us productive and safe. So do the right thing. That's what integrity is all about. That's how we can demonstrate it, is by following our core values. And if we don't know what they are or identify them, it's good to think about it a little bit. You know what they are. Your body will tell you. So a couple of things to add here to the equipment. I'm going to whip through this quick, and then we're going to have a directive on off-road fuel. Take care of our stuff. Our equipment's our biggest asset besides each other. We rely on it to perform our work safely, accurately, and efficiently. When we keep it clean, it reflects who we are. Good looking equipment that is well maintained shows others that we take pride in what we do, and that we respect our tools, and that we operate to a high standard. So keep your equipment clean, keep it free of clutter. Inspect it when it gets to your job. Inspect it every morning before it's used, and make sure to inspect it and make sure it's in good condition before it leaves. Check your oil every day before starting the machine. Check your coolants and your hydraulic levels. Grease them every day, or more if it's needed, and follow the maintenance schedules or the recommendations that usually told to you by your leaders or the shop guys. Report problems. Use Fleetio, or call the shop, call anybody in the shop, call Pat, call Tyler, call Chico, any of the other guys, and they'll help you with problems or issues. The Fleetio app is a good thing. I've reported a couple things that I've seen, and it gets the information to them right away. You want to always make sure to leave your stuff in good condition for the next user. This practice helps us prevent downtime. It extends the lifespan of the equipment, and it ensures that everything's safer for everyone. So treat it as if it were your own, because it actually is. So the last week has been very cold. It's hovering around 0 right now, Tom?
Something like that. I know I walked outside and just about froze.
Yeah. There've been a lot of problems with fuel gelling, most especially with the off-road fuel. So we'll try to get an email out to you saying the same thing. But for right now, if you're going to get off-road fuel at Global, like if you're going to get your off-road tank filled in your truck, we need you to cut it with 20% kerosene. So that means for every 100-gallon tank, you need to put 20 gallons of Kero in. You can get it at O'Brien's. They have it in the pump. So the ratio is 20%. So it's 20 parts of, or 20 gallons of Caro plus 80 gallons of fuel, of the off-road fuel, that would make 100 gallons. That's a 20% cut. If you have any questions, you can ask people. For a 5-gallon can, it would be, for example, 1 gallon of Caro in a 5-gallon can. So 1 plus 4, that's 20%. So for right now, that's what we're going to do. Especially when these temperatures are like they are. The fuel filters are getting gelled up, and the fuel's getting gelled in the lines, and the guys are struggling a little bit, keeping everything going right now. 20%, 20% Caro. Get it rated O'Brien's if you're going to get off-road fuel from Global. Okay, your W-2s, you should have them. If you don't have them already, if you don't get them by the end of next week, call Erin, see what's going on. She can actually print one if something happened with the U.S. mail. But those should be in your mailbox already. I think I got mine a couple of days ago. I've heard of a couple others that have got their W-2s. Tom Fidgen, do you know if you got yours? You got yours?
I haven't been home, so.
You haven't been home. Oh yeah. Gotta go down and check. So if you guys don't have them, let Erin know. They can reprint them for you. So the qualified overtime reports, they've been reissued and mailed. They're on blue paper. The previous version had some slight errors in it. So these new versions of the qualified overtime should be in the, they went in the mail yesterday, so you should have them within a few days. If there's any questions with that, let Erin know. And what these qualified overtime reports are is it tells you what your qualified overtime that you can deduct from your taxes due to the new bills that went through, that allow you to not pay some of your taxes on your overtime. So that's a good thing. So if there's any questions with that, let Erin know, and she can print you out your report if you didn't get it. But they put them on blue paper. The reason they did is the blue one's the good one. The white one's going to be no good. Next week, we have 401k meetings. There's going to be probably Laura Strela, who's our financial advisor. She'll be here between 8 o'clock and 11:30. Let Erin Markle know, and she can set you up for an appointment. They're usually a half hour long, and it's good. It lets you get all your deductions all set up, and they can talk about your balances and also different things that you have that are optional to you to do with your 401k funds. So if you haven't done that, sign up. So there's only probably a few slots left. I put a reminder in here about the floating holiday. It's one of those holidays that some of us forget about. So I ran that again this week just so that you all would understand how to do it. And I think I've seen quite a few people using them already. And you're not going to lose it. If you don't use it, we're going to pay it out to you once we get past March 15th. I just left the annual giving in, just if anybody else wanted to just check out the totals. Thought that'd be a good idea to leave that in one more week. I usually run that through January, so that'll be the last time we have that in here. This week, we're going to talk about the Clyde Allen project up in St. Albans. And if Heath is on, I'll let him present it. Heath, you on?
Yeah, happy to.
Hey, would you like me to try to steer this thing for you?
Yeah, sure. Thank you.
Okay.
ECI was contracted by the town of St. Albans to construct a new stormwater collection system and gravel wetland in the Clyde Allen Drive neighborhood. The project consists of installing 500 feet of 18-inch HDPE storm pipe, 6 precast concrete manholes, and a new gravel wetland with a liner. The project had a funding deadline of early March 2026, so we were in a time constraint to get the road crossings complete and repaved this winter. The western road crossing was especially challenging with a 14-foot deep excavation, sewer line crossing, water line crossing, and an adjacent gas line that required relocation and poor soil conditions. And I should note that none of these things were anticipated. This was all, just basically due to lack of due diligence on the engineer's part. The pipe run became shallower as it crossed to the east. There were multiple communication, electric, gas, sewer, and water line crossings, with many of them being so close to each other that trench boxes did not fit between the utilities, which forced us to bench the excavations. The pond was approximately 50 foot by 150 foot in dimension with a 30 mil liner. 2 excavators were needed to stretch the liner out across the pond, and then one held it in place while the other placed crushed stone on top of it to fix it into place. The liner was too large, heavy, and slippery to maneuver by hand. The pond features a stone-lined 4-bay, 24-inch and 12-inch diameter SDR35 lateral piping, a concrete outlet structure with a custom fiberglass weir wall, and 3 feet of crushed stone and wetland muck. One of the primary challenges of the project was the poor weather conditions we experienced from the very start of the project. But not only did it rain at the very beginning a lot, the constant snow and freeze-thaw cycles made the already poor soil conditions even more difficult to work with. There were also multiple utilities in the ground that were either not marked or that the town and engineer had no knowledge of, including the sewer and water systems, which we found multiple times and had to repair in the field. Contributing to the extremely wet conditions, there was also an underdrain collection pipe that collected groundwater from all of the house footing drains uphill of the project, and a homeowner had previously excavated years before and broken the main line near where the new stormwater system was crossing his property. The main line has been collecting groundwater from around 8 house foundations and concentrating it into the soil in the area we were crossing, making this area completely saturated. We worked with the homeowner and the town to repair this line and tie it into the new stormwater system to prevent water from backing up into the homeowner's basements. The window to pave closed before we were ready to pave the road crossing, so the paving crews pulled mix from Massachusetts between Christmas and New Year's and got the road back open, paved, and able to be plowed for the winter. We will return in the spring to install topsoil, chain link fence around the pond, and perform any punch list items that need to be completed. So this looks like one of the rainy days. It's very wet, getting ourselves set up, getting boxes in the ground.
You guys are right in that neighborhood too. Behind us is all those houses, and on the other side.
Yeah, fortunately, the neighborhood has a U-shaped roadway so that at any given time the neighbors can get out of their homes and out onto the main roads, even if we're blocking the whole road. So that was handy. There was a lot of deep excavation on this with a lot of supporting of existing utilities. It was a mess of utilities. They didn't know where anything was. We ended up going out and doing a bunch of test pits ourselves and finding some of the infrastructure that was known and determining that there were conflicts before the project even began.
Yep, look at all that stuff.
Yeah, it was a tough job. It was a really tough job. The conditions were tough. The weather was tough. It was wet. It was it was one of those things where we kept pushing and pushing this project farther and farther into the year to try to get other stuff wrapped up, and the weather was great for it at sometimes of the year and when we could have done it, I guess. And then when we ended up doing it, the weather just turned to the worst for us. So that was unfortunate.
A lot of unbroken stuff there on this picture.
Yep. Yeah, there was a lot of hand digging and a lot of slow excavation.
There's wires, conduit, wires. There's like 7 things crossing there.
Yeah, that was the job. It was like that everywhere.
Good job.
These developments are tough.
Good job getting through all those without breaking them. Holy cow.
Yeah, I think we ended up hitting, was it a calm line that was 6 inches deep, something like that, just below the grass roots, basically.
Pretty much,
Those ones down at the very bottom, they're very small. Those are just like cable TV or something, right?
Yeah.
Holy cow.
Yeah, it's hard to determine what is live and what is banded as it's an older development. So there's communication upgrades. There's probably a couple of them that are dead, that are just old copper in the ground. Makes it hard. Guys did a good job.
Yeah, the guys did. They persevered and they stuck with it, and we got it done. it was really important to get the project done before March because the funding for this project was going to be terminated in March. So if we didn't get our billing or invoices to them by then they wouldn't have had the money to do the job. And so it was really important. And that's why we're pulling mix out of Massachusetts to get this thing done.
Yep. Getting some, that's a good sized pipe.
Here's some of our struggles, trying to dewater this site. We had to dig deep there and it was tough, very tough job. We are running some pipe for the pond. Here's an image of us. Looks like we're starting to shape the pond or wrapping up in it, putting in that structure and getting ourselves a road. We had to build a pretty robust road to get in there.
That's up on, that machine in the back is up on top of the roadway, right? Yeah.
Yeah.
Looking out towards the road from the pond.
And then here's a great image of another weather condition that we dealt with. It got cold and it snowed and it was a battle.
Insulation. Oh,
Here's
there's
the guys. Here's the guys stretching out the liner. That thing is tough to deal with. It definitely took machinery to get it stretched out.
Holy cow. 3 mil?
30.
30 mil.
Yep.
Excuse me. Holy cow.
So that's an image of the pond taking shape and getting wrapped up and getting that lower berm completed. You can see the forebay on the right and the stone lined weir in the middle, and then on the left is the main cell of the pond with an overflow structure there sticking up to SDR 35 with a grate on top.
Oh yeah.
Here we are prepping for paving and just after Christmas.
Looks like
And
it
here
was that day looks a little warmer than today. A little bit.
Here we are paving between Christmas and New Year's.
Yeah. Well, the mixes still looks hot, so that's good. Thank you, Mr. Heath.
Welcome.
So I'll get to the archives in a minute. Just remember, I'll stay on just for a sec after. I just want to reiterate our fuel cut. Archives, Elm Street
Hey,
rail crossing. Yeah, go ahead.
Hey, that project of the week. Yeah, those neighbors are hard to deal with up there. Real hard to deal with. And some of them take great pride when work's done in their own neighborhood. I'm talking about me. Great job, guys. And as far as what Ben was talking about with hard conditions and the job sites that we go to, there's times in June I will get my lawn tractor stuck in my lawn due to the amount of water and soil conditions. They hats off. They really had their hands full on this one.
Yep. Well, that sounds, thanks, Todd. That sounds good. I didn't even realize we were in Todd's neighborhood.
Oh yeah, didn't even dig up my front lawn either. That's even better.
I told the guys to, Todd, but they didn't listen to me.
Yeah. There was threats that my dog was going to have some cuddle time, but anyways.
Cool. That's awesome. It's always scary to work in your own neighborhood or work in one of our own neighborhoods, isn't it? It's like, oh boy, if anything's gonna go wrong, that's when it'll happen. It's like doing work for you. Don't do your work for your friends, right?
Yeah. No, sense of pride is a good thing.
So thank you, Todd. Here's another job up in St. Albans back in 2013. Is that a young Ron on the left there? I don't know. Young Ron Johnston doing maybe. I think I see both Rons in those photos. That's some of the concrete sidewalk work going towards the rail crossing on Elm Street. We didn't have any. Ron Wallen and I talked about it last night. I didn't have any pictures from before, but these are the after pictures of that rail crossing. There's a lot of tracks crossing there. There's the approach to the sidewalk crossing all those rails. That looks like July of 2013. So that's a few years ago. There's the train coming. Pretty cool project. I remember going up there and checking that one out 13 years ago. Okay, so if you get off-road fuel from Global, we're gonna cut it 20% with kerosene, which you can get at O'Brien's. Okay. Any questions? Talk to the shop guys. Talk to your leaders if you need help figuring out how to cut it. I'll turn it back over to the safety guys.
Yep. Have a
One
great
minute
day.
over.
Have a safe day. If you watch in a group setting, please send over attendance and we'll see you next Friday.
Thanks, everybody. Be safe.